Hello, and welcome to my poster presentation. My name is Alex Hammond, and my summer research focused on the Tenon's capsule fascia and how its protein composition changes with aging and with previous ocular surgery. Tenon's capsule is a fascial membrane of elastic connective protein that envelops the eye from the intermuscular septum to the optic nerve. Tenon's capsule is commonly encountered during strabismus surgery, a surgery that corrects misalignment of the eye through resection or recession of the extraocular eye muscles. In order to access these extraocular eye muscles, Tenon's capsule is commonly excised. Interestingly, the composition and biological function of Tenon's capsule remains poorly understood. As a result, there is little consensus whether the Tenon's fascia encountered in the surgical field should be minimally disrupted to prevent prolapse, or intentionally excised more widely for ease of access during strabismus surgery. Further understanding of the composition of Tenon's fascia and how it changes with age and with a history of prior ocular surgery may shed light on the function of Tenon's capsule fascia and best practices for its handling during strabismus surgery. This study aims to determine the protein composition of Tenon's capsule fascia and how it changes with age and prior ocular surgery. We hypothesize that Tenon's capsule fascia protein composition changes both with aging and with previous ocular surgery, decreasing in collagens with age and increasing in fibrotic proteins after surgery. The specific aims of this study are to determine the protein composition of Tenon's capsule using protein tandem mass spectrometry, identify changes in Tenon's protein composition with aging, and between subjects who are surgically naive and subjects who have had prior ocular surgery. In order to accomplish these aims, Tenon samples are being collected from subjects undergoing strabismus surgery as part of their standard of care. Samples will be collected from subjects in each of 3 age groups: children under 18, adults 18 to 55, and older adults who are 55 years and older. Each age group will have 2 different categories: surgically naive and subjects who have had a prior ocular surgery. 6 samples will be collected from each of the 6 subject groups, totaling 36 subjects. An additional 4 samples will be collected for mass spectrometry analysis method development for a total of 40 subject samples. Samples will be analyzed using liquid chromatography with tandem mass spectrometry. Paired t-tests will be utilized to compare abundances of individual proteins of interest between sample groups. Additionally, subjects' medical history, ocular surgical history, postoperative course, and any other relevant information will be reviewed via subjects' medical charts and recorded. To date, 33 samples from 20 unique subjects have been collected, which means we are exactly halfway done with sample collection. Mass spectrometry analysis will be conducted following collection of all samples. In Figure 2, you can see our collection progress by age category. We have met our collection quota for the surgically naive sub-18 group. On the other hand, we have yet to collect any samples from the surgically naive above 55-year-old subgroup, as strabismus in adults is commonly caused by thyroid eye disease, which frequently requires orbital decompression prior to strabismus surgery. Table 1 shows the average ages of each subcategory. Initial trends show that our surgically naive sub-18 group will be significantly younger than our prior surgery sub-18 group. This may make it difficult to determine whether the differences in protein composition between the 2 groups arose from aging or prior surgery. Our 18 to 55 subgroups are not significantly different in age, while it is too soon to say for our above 55 age groups. Our study will determine the previously unknown protein composition of Tenon's capsule fascia and how its composition changes with aging and after ocular surgery. This information may shed light on the function of Tenon's capsule fascia, what its purpose may be, and benefit patients by improving future ocular surgical procedures. Future directions for this project may include observing healing outcomes with versus without Tenon's capsule fascia excision and protein composition in these cases for comparison. With this knowledge, surgical management of Tenon's fascia and potential therapeutic interventions to improve surgical outcomes may be developed. Funding for this project was provided through the NIA T35 Aging and Injury Grant. I would like to thank my mentor, Dr. Kassem, for her indispensable input and guidance. I would also like to thank John Young for his excellent advice. Thank you for listening to my presentation.